A month ago, Jeff could barely hold this coffee cup, but a new device provided hope.
You know, it's been years since that you have been shaken, and you think to yourself, that can't possibly be my hand that's holding onto the cup that steady.
See how the operation changed his life. Thursday on the KWWL News at 6.
A new surgery is helping many people with unexplained tremors regain control.
Tonight you're going to meet a man from Cresco who is one of the very few to have this surgery, and you'll be able to see the amazing difference it's made in his life. That's next on Healthline.
WWL Healthline Report is brought to you by Mercy Health Center of Dubuque.
This is exciting. A new device is helping people with tremors.
There's a man in Cresco who's had tremors almost his whole life. There was no explanation. He was diagnosed as having benign essential tremor. And at age 30, Jeff Ryan decided to give brain surgery a shot. It would change his life. Farming can be a dangerous business, and it takes a steady hand. Jeff Ryan learned how to adapt. You can see how his tremors affect his work. It started at a young age when Jeff noticed he had trouble buttoning his shirt.
You know, when my hands are at rest, you won't notice it. But as soon as you try to move those hands and control any kind of movement with them, that's when it becomes obvious.
When Jeff heard about Medtronic's Activa tremor control device, he knew it was for him. The device is implanted in the brain and the chest. It uses mild electrical stimulation to block the brain signals that cause tremor. Jeff demonstrates how he can turn it on and off with a powerful magnet.
And hold it up to the device for 3 seconds, then the tremors come back. And so then it's done. A little bit more difficult to hold on to that and control.
The device is implanted on the right side of the brain, so it has stopped tremors on the left side. To stop the tremors on his right side, Jeff would have to get another device on the left side. Maybe someday, but for now, he's pretty happy he doesn't have to deal with all the medication anymore, and with having a steady left hand.
You know, you have your whole life ahead of you, and if your option is increasing doses of drugs that are going to wear you down for the rest of your life, or this operation, it makes brain surgery look pretty minor.
And Jeff is one of the youngest people to get this device. He's 30 years old, and 29 was the youngest.
So he has unexplained tremors. What about, like, we've all seen Molly Parkinson's disease? What about that?
This does help implant that's not approved yet for implant on both sides, but that's probably to come.
What a life-altering option.
Oh, yeah,
Wow.
in an instant.
Jimmy.
Wonderful for Jeff. Well, next in sports,
Cool, it is. Janet Reno, Muhammad Ali, they are just some of the people stricken with Parkinson's disease.
Now a medical breakthrough that is changing the lives of Parkinson patients and others. Health news you can use is next.
John and Kathy return with more news.
Like others with Parkinson's disease or heredity tremor, this Cresco farmer's hand shook so much he could barely hold a cup. And then he heard about a medical breakthrough.
It is a new surgical procedure being done in Des Moines that changed his life dramatically. Health news you can use reporter Mary Mills shows us how.
30-year-old Jeff Ryan developed essential tremor as a child. For years, his hand shook so uncontrollably he could barely hold a cup of water.
I'm a farmer, so I work with tools all the time. That was getting tough to do, to coordinate any movements. It's embarrassing to be out in public.
But everything changed last March when Jeff had an electronic stimulator implanted in his brain. It stopped the tremors on his left side instantly.
And it's, without question, the best thing that's ever happened to me, because you regain the total ability to hold that hand still again.
It's a major breakthrough. It's been going on for years. They've been trying to find surgeries that would help tremors.
Neurologist Lynn Struck was first in Iowa to use the electronic stimulator.
We know somehow that it's blocking the electrical stimuli that come into the area of the brain called your thalamus. That's your tremor generator in the brain. And how it works, we don't know.
But it does. The stimulator is programmed by the doctor and powered by a battery pack implanted near Jeff's collarbone. Jeff turns it on and off with a powerful magnet. Here, he writes with it on. When Jeff turns off the stimulator, the tremors return. Now, Jeff would like to have another stimulator implanted to control the tremors on his right side, but the FDA has yet to give its okay for implanting more than one stimulator. But even with just one steady hand, Jeff says it's changed his life dramatically.
The possibilities now are more or less limitless because you have good coordination, a steady hand to do just about anything.
Including holding that cup of water. Mary Mills with Health News You Can Use.
Well, studies on the electronic stimulator are also being done with MS and brain injuries.
That was great of Jeff to demonstrate for us, too.
Oh, no kidding. Imagine the difference there.
Well, imagine, speaking of imagine,
Live, that's right.
Being the first to try something new can be scary, especially when you're talking surgery. An Eastern Iowa man has had tremors most of his life, so it took little thought for him when deciding whether to take part in a first-of-its-kind surgery in Iowa.
Because you're going along, holding on to something, and your hand will be shaking back and forth violently, and all of a sudden, it's steady.
Heather King takes us inside the operating room as doctors attempt to find the spot in the brain that controls Jeff Ryan's tremors. Tune in tonight at 6 and 10 for Heather's special reports to find out how successful that surgery was.
Amazing to watch, really. And finally,
This operation is the first of its kind in Iowa, but Jeff Ryan knows what to expect.
To sit there with that hand like that and know that it could be done the same way, it's not a tough decision to make.
I'm Heather King. I watched Jeff's groundbreaking surgery. Join me in the operating room tonight on the KWWL News at 6 and 10.
If you live in
From a courthouse milestone to a milestone in an Iowa operating room, a medical first for one Iowan.
You're looking right now at video from inside the operating room as the surgery is being performed. Iowa's News Channel had the rare opportunity to take cameras in to record this unique procedure.
In fact, this surgery has only been performed a few times all across the United States.
And our Heather King was there for its very first performance in Iowa, and we were able to get a sneak peek as you were putting the story together. It's incredible.
It's really fascinating to watch, and it was an experience, really, that I'm never going to forget.
That's right.
Now, you may remember we last introduced you to Jeff Ryan last spring, it was. He's a 30-year-old Cresco farmer. He had his second brain surgery to control tremors last week in Des Moines. Doctors implanted a second tremor device in his brain. Jeff has severe essential tremors. They're unexplainable and a real pain when you do the kind of work Jeff does. Jeff got his first implant, the Activa tremor control device, a few months before our visit, right after they were approved by the Food and Drug Administration. At the time, he was the youngest in the country to get the device. This diagram shows where the electrode is placed in the brain with the wires leading to the chest, where it can be turned on and off with the aid of a magnet. What's even more amazing is this latest surgery is not approved by the FDA, but Jeff got the go-ahead anyway. They brought him back to the operating room at Iowa Methodist Medical Center in Des Moines. He invited us along to document the procedure. Will the operation be a success? Watch and see. It's next to impossible to hang onto a glass with one hand when you experience tremors like Jeff Ryan's. But watch as he turns on his tremor control device. With a wave of the magnet, the device is activated, and Jeff's tremors are gone on the left side. This is the moment he craves for his right side. Jeff is waiting to have a bilateral or dual implant, a second one that will hopefully greatly reduce the tremors on his right side. Here's a comparison of the left and right hands. Jeff's impressive results the first time around are what draws him back for another surgery.
Once you get that hand steady, and that one's pretty good, and then you look at the other option, you know, to sit there with that hand like that and know that it could be done the same way, it's not a tough decision to make.
After some blood tests, a nurse comes to ask Jeff questions about his medical history. His sister, Roxanne, is here for support. Then it's time to move to the next phase. The big moment is another step closer. Jeff's head has to be shaved. He jokes these are the pictures his friends want to see. Roxanne, meantime, marvels at his demeanor.
I'm amazed at how calm he is, because it's brain surgery.
Are you ready?
Dr. Thomas Carlstrom will be performing the surgery. He's here for final preparations before the operation. These are the moments Jeff dreads. It will be the most painful time of the whole procedure, and it all happens before any cutting.
Target is going to be about right there.
They're using a new stereotactic device, so they're being extra careful each step of the way. Jeff closes his eyes while Dr. Carlstrom places the device over his head.
Okay, stick back here.
He's going to screw it into place, all the while using shots of anesthesia at Jeff's direction. It's painful to watch, much less experience, but it's needed to hold Jeff's head steady during surgery. Jeff says the worst is over. Next, the CT scan.
Now, Tom, when you go upstairs, is that right? And Judy, this is for you too. Is this the only fiducial you use? Or do you use these? Yes. Yeah.
The computer shows where the first electrode was placed to stimulate the target in the brain.
We're going to put a new electrode right there.
Dr. Carlstrom will go for the exact location on the opposite side for the new implant. Jeff lets us know how he's doing at this point.
I can feel a little bit of pressure on my head, but other than that, I feel good.
And it's time to go to the OR.
He'll know right today if this is going to be successful to do it on both sides or not.
So we're going to pick up the story from there tonight at 10. Just a reminder, that's when you're going to see most of the graphic video, so if you're kind of squeamish, you might want to pass, maybe just listen.
Sure.
And by the way, this same procedure, a lot of people ask, this is the one that Michael J. Fox had. Many Parkinson's patients might be able to have some use out of this too.
That is really amazing. In fact, I had a chance, kind of coincidentally, to meet Jeff Ryan's mother today, and she was looking very much excited to see her reports tonight.
She's a wonderful person.
Son. Yes, yeah.
Good apple pie.
Yeah. And Jeff does a lot of talking tonight at 10, too.
Oh,
yes,
man.
he does. You'll be surprised.
Looking forward to that, Heather.
I'll tell you, that is really something.
Sounds simple, but imagine not being able to hold a glass of water because your hand shakes so badly.
Well, one Eastern Iowa man knows that all too well. He is hoping a first-of-its-kind surgery in Iowa will help him.
At 6 o'clock, we told you about the procedures leading up to this historic Iowa surgery. Tonight, we bring you inside the OR so you can see up close whether the surgery is a success.
First tonight, we're going to catch you up on the facts, just in case you did not see the first half of our story tonight here at 6 o'clock. Now, Jeff Ryan is a 31-year-old Cresco farmer. He had unexplained tremors since age 6 or 7. They got progressively worse. Now, just last year, Jeff was the first person in Iowa to have a tremor control device implanted on the right side of his brain to control the left side. And last week, he became the first person in Iowa to receive a second device to control the other side of his brain. This bilateral implant is not an approved procedure by the FDA yet, and there is some risk involved. When we left off at 6 o'clock tonight, Jeff was getting prepped for surgery and was being taken into the operating room. Be warned, the video we shot tonight shows some graphic pictures of the actual surgery process. Tonight, Heather King reports from the OR.
1.2.
Final adjustments are made before the drilling begins. They're working with new equipment, so it's taking a little bit longer than normal. After measurements are checked and double-checked, Jeff Ryan is ready for the drill.
Start drilling here.
Dr. Thomas Carlstrom gets the honors. The drill is not what you might imagine. It's a hand crank drill. Might seem a little primitive, but it's a drill most neurosurgeons use, and it's more cost-effective over an air drill.
Might start to get a little headache here in a minute. If you let me know.
The thing that most people find so incredible about all of this is that the patient is awake during surgery. Jeff, how you doing?
Pretty good right now.
The brain has no nerve endings, but Jeff does start to feel some pain.
I'm through the skull doesn't hurt, but the lining over the brain does, and I just put a little Novocaine on that right now.
Once through the skull, Dr. Carlstrom places a thin wire lead with electrodes on the tip in the thalamus, deep within the brain. Now the testing begins. This is why Jeff needs to be awake. In order to tell if they've hit the right spot in the brain, they need to observe the tremors. Jeff doesn't have tremors when he's asleep. Watch as they turn on the pulse generator. It's similar to a pacemaker and uses mild electrical stimulation to block the brain signals that cause tremor. Neurologist Lynn Struck monitors the progress.
Do you feel anything, Jeff?
Nothing.
Okay. Try doing this for me once.
We're at 2.
You know to tell us if you feel anything, right?
Right. So I don't feel anything.
Okay.
3.
Wow.
Pretty good, Jeff. Now, you got to talk a little bit here for me. Why don't you say your name?
Jeff Ryan.
But it's not as good as it could be, and Jeff wants to keep trying.
And what we're doing now is changing the depth a little bit of where the lead is in the thalamus.
They've gone below target now, and now another try.
That's really very good. Here, do your finger for a second.
Want to go to 3?
Hand rest.
He doesn't have any tremor now.
That's what it's going to be.
Looks fine to me. What do you think? Here.
Jeff has 95% tremor control. Now they'll put him out to implant the pulse generator below his rib cage.
Well, I think it went fine. We had he's got a tremor that responds very well to the stimulator and worked right off the bat, which is very nice. And really can't expect it any better than that.
Everything went fine. Everything went really well. He's doing fine.
Jeff's family hears the good news. While the waiting took hours, once doctors were in, the brain implant only took 10 minutes. I'm Heather King for Iowa's News Channel.
In fact, Jeff was out of the hospital the next day. Some people actually go home the same day, and Jeff's tremor control device is turned off for now, but in a month he'll go back after the swelling goes down to get it turned back on.
In another bizarre medical case, and Jeff Ryan was out of the hospital the next day. Some people go home the same day. His tremor control device is turned off for now. He'll go back on the 17th after the swelling goes down to get it turned back on.
I'm just shocked.
I know. It was
speechless.
I was speechless while I was there too. I was completely amazed by the whole thing. I didn't think I'd be able to watch it, and I couldn't stop watching it. It was just so interesting.
I wanted that story to keep going.
And I wanted to thank Jeff for letting us be there too. Brain
Very
surgery
courageous.
is hard enough,
Yeah.
much less having it underneath the camera. So
Yeah, very courageous. And I found it amazing that he was actually he was awake and talking while they were doing that.
Yeah, very coherent.
Man, I'd be scared.
He's very brave.
Very brave
Very
guy.
brave.
All right, weather. Let's take a look at some.
Okay.
I had the basic shirt without their names on it 6 or 7 years ago, and so the artist's name is down in the corner of the cartoon. I got on the internet, did a search for him, and found him in Salt Lake City. He runs a greeting card company. He's an anesthesiologist. Yep. So I called him up and I described the procedure that I had done, and I said, I've got one of those shirts, and here's what I have for an idea. Is there any way we could get my doctor's names put on that awning, because I think there's room there for it? And he said, not a problem. He went and looked in his inventory, and I think he had about...
The KWWL Healthline Report is brought to you by American Home Patient.
Helpline tonight, in Iowa First Surgery getting its finishing touches right now in Des Moines.
Earlier this month, we told you about a Cresco farmer's brain surgery to control his tremors. The device, implanted partially in the brain, was turned off for a recovery period. Heather King was at Iowa Methodist Medical Center when they turned it on and has this report.
So it's still not quite as good as the left hand, but considerably better than if we turned it off.
Compare this scene with the one several weeks ago. Getting prepped for brain surgery, Jeff Ryan shows us how a tremor control device can eliminate involuntary movement on one side. He's already had a device implanted on the right side of his brain to control the left, but he's back to have the other side done. Here's how it works. A pulse generator is placed somewhere in the trunk of the body. Wires lead to an electrode implanted in the thalamus, deep within the brain. The pulse generator sends mild electrical signals to the electrodes, which will hopefully override the brain signals that cause tremor.
This is what the pulse generator looks like, and they put it right about here on Jeff. Since it is battery powered, they're going to have to replace this about every 3 to 5 years.
But that's the easy part. The brain surgery was a success. An office visit 3 weeks later is to program the device. Nurse Karen Halder is trying to find the best parameters. She's working with numerous combinations of the pulse strength, duration of the pulse, and the number of times the pulse is delivered. They've been working for a couple of hours, but it's not as good as the other side, and Jeff is getting a tingling sensation in his leg.
And part of this could be that there's still some swelling there in the brain that needs to go down, and when that settles out, then it's a little bit easier to even get better tremor control.
Well, it changes exactly where the lead is placed, and it can affect, therefore, some of the programming parameters, and it may be a little bit too low right now that we're getting the leg, and we just need for it to make sure all the swelling is resolved before we reprogram again.
But the tremors are much smaller with these settings.
They'll take a break and try again in a couple of weeks.
You don't really know what to expect first. You don't know what to do. I think I'll probably just go through the usual routine of activities and stop and marvel a few times every day as you do something. You think, wow, I couldn't do that 2 days ago.
If they can't get better control, Jeff says he's very happy with this. I'm Heather King for Iowa's News Channel.
Doctors are considering another reason for not getting as much tremor control as they'd hoped. The electrodes could have moved slightly while repairing the skull. They'll see at the end of the month.
Kind of remarkable, the doctors telling us that they don't really know what causes the tremors, but they know how to eliminate them.
Absolutely. And what a life change it has made for him, too.
It's remarkable. We had a chance to meet Jeff's mom earlier, too. She was pretty excited about the surgery,
to say the
too,
least.
on her son. That's right. All right. Continued success, Jeff. Coming up next, Iowa's new basketball coach says goodbye.
Okay, now let somebody else have a turn.
You did a really good job putting that brain together.
Well,
not exactly, but...
The brain. Here, let me do
This would be the front of the brain. This is the top. You guys, stop.
Hey, Ryan.
Hey, Joe. So
Your brain and well, it won't slow the brain down, but it will help
Who cares? It's a little bit. They do a whole about the size of the dime.
They ask you
The spinal cord, we can connect it to this. That's the wire.
Now, what part of Iowa are these? We really appreciate it.
Thanks for being here, Steve. It's really nice of you to take time. Really appreciate it.
The seismic activity in Italy has helped keep the recently active Mount Etna erupting. Experts are unsure what Mount Etna will decide to do next, but they do suspect the eruptions may be slowing down.
Well, Amy did take time away from her regular duties today to try her hand at farming. While she was working on another assignment you'll see later this month, Amy combined crops with Jeff Ryan in Cresco. Once she became familiar with the equipment, she took the wheel. Ryan says this year's crop is the best they've ever had, and it's right on schedule. And as far as Amy goes, he said if she wanted to make a career change, she was doing a pretty good job. Now, I did a lot of that about 15, 20 years ago, but I can say the last 2 or 3 years, you've done more than I have.
It was a blast. Had a good time, and I appreciate him letting me take over there, but good time.
I'll bet. Kind of nice weather to do it, too.
A unique medical device is helping one North Iowa man live life to the fullest. Jeff Ryan has a condition called essential tremors, causing him to shake uncontrollably. But a few years ago, he underwent surgery to install 2 deep brain stimulation devices to help control his symptoms. Ryan can turn the device on and turn it off.
That's probably one of the best parts, is that you have the advantage of seeing what life can be like without it, too. The difference between having the device turned on and turned off is dramatic.
You'll hear more from Ryan and find out how the device works, plus why it could also help patients with similar conditions in a special Covering Your Health report, Brain Surgery Success, tonight at 6. Pete, back to you.
All right, looking forward to that. Thanks, Amy.
Relief is brought to one man who believed his shaking would never stop. Thursday at 6, Amy Fleming brings you a Covering Your Health special report. Can a simple remote control change the signals your brain sends to your body? Brain Surgery Success. Thursday on KIMT News Channel 3 at 6 p.m. Coverage you can count on.
Imagine not being able to control the movement of your arms or not being able to drink a glass of water because your hand is too shaky.
It's something very real for many people who suffer from conditions that cause uncontrollable tremors. KIMT News Channel 3's Amy Fleming joins us from Studio 3 with a special Covering Your Health report. Amy.
Thanks, Pete. A tiny device could make a big difference in the lives of patients who suffer from Parkinson's disease or also a condition called essential tremors. The device is called a Deep Brain Stimulator, and for one North Iowan, it's been a brain surgery success. This is what even the simplest of tasks were like for Jeff Ryan for many years. But now, with the help of a deep brain stimulation device, life is much different for this Cresco man.
It's night and day. The difference between having the device turned on and turned off is dramatic. And it's the difference between life and just existence.
Ryan was diagnosed in high school with a condition called essential tremors. He spent 15 years on medications, but the side effects became too much. In 1997, he explored the possibilities of surgery to control his tremors. By 1998, he qualified for surgery to implant a deep brain stimulator device, and now has 2 stimulators controlling his symptoms on both sides of his body.
There's a lot of things that people in the general population just take for granted. Drinking a glass of water can be extremely difficult with a condition like that. Buttoning your shirt, writing a check.
The device works like this. Small electrical impulses are sent through insulated wires to the brain and block the signals that cause tremors. Patients can turn the stimulator on and off with a remote control device. A neurosurgeon at the University of Iowa Hospitals and Clinics is one of 3 principal investigators in a nationwide clinical study on the device and its effects on another disabling disease.
We want to compare the effectiveness of surgery compared to medication therapy for Parkinson's. Secondly, we want to look at the effectiveness of surgery, specifically deep brain stimulation, in 2 different sites of the brain in terms of how they affect symptoms of Parkinson's disease.
Dr. Follett says there are clear-cut benefits of surgery for Parkinson's disease patients who have trouble with side effects of medications.
The goal is to help people be more comfortable and have a higher level of functioning than they have with medication therapy. We know that we aren't going to cure Parkinson's with the surgery. The goal of surgery is to treat the symptoms.
The device is working to treat Jeff Ryan's symptoms, and he says he hopes others will also find relief through this surgery.
There are people who can benefit from a device like this, and when you find someone like that who benefits, it's a great feeling to know that you've helped somewhere along the way.
Ryan says the device has helped him better operate his family farming business of about 1,800 acres of corn and soybeans, beef cattle, and hogs.
Amy, as far as the clinical study for Parkinson's disease patients, can people still get involved?
Yes, that's right. Patients are being enrolled at 13 locations across the country, and you can find out more by calling 319-353-6679, or you can also go and get that phone number at KIMT.com and just click on Health. Live from Studio 3, I'm Amy Fleming. Back to you, Pete.
Unbelievable story. Thanks, Amy.
Good morning show with James and Corey. High today 45 with some showers and an isolated thunderstorm or 2. It's 43 and overcast at 8:13. KROC early morning show is proud to welcome Jeff Ryan to the show. Good morning, Jeff.
Good morning.
You have what I think is an amazing story, and part of it is a funny story because, you know, you really stuck it to
you stuck it to him.
Large medical
Stuck
facility.
it to the man. Stuck it to the man.
And also because I think you are a walking miracle. I think what the surgery that was done is quite frankly astounding. So let's start with that. What was your problem and what did you have fixed?
The condition I had was called essential tremor.
Uh-huh.
And so that's, it's like rhythmic shaking of the hands. It's similar to Parkinson's disease.
Okay.
So it's hard to control your hands. Holding onto a glass, doing all kinds of fine motor control is tough.
So in the commercials, in the video rather, they show you, you're shaking so much that, a spoon will rattle around in a cup. It's hard to drink easily.
Yeah, ice chatters something terrible in a glass. You can't drink a cup of coffee. It's like Robert Hayes, the old airplane movie. I have a drinking problem.
Okay.
And this was constantly, I know I had way too much coffee yesterday, like a pot of coffee, and I was a little shaky. Nothing compared to this, nothing. And you had it all the time.
Yeah, basically from the time I was a fairly young kid. I was a diabetic at the same time, so, we always just figured that shakiness was associated with low blood sugar.
Right. And you are also a farmer, and you do some pretty... I want to call it minute work, but it's, it's very particular work you have to do.
Yes. takes a lot of control with your hands, and when you don't do it steady, you don't do it nearly as well.
Right.
And that makes a big difference when it's your job.
Well, and dangerous.
Yeah, that too.
So, what do they do to fix you up?
Well, what they did was they put a device in. It's similar to a pacemaker, and that goes in your chest, and then they run some wires through the brain down to the thalamus, and that sends a electrical signal basically into the thalamus and overrides those tremor signals, and so you don't shake anymore. Now, the strange part of the surgery is that you're awake while they install this.
Yeah, watching the video of you that KAMT had and stuff, it's freaky because you're talking.
It's a little disturbing. I didn't like the poking in the head.
The patient has to remain awake during surgery because the tremors go away if you're asleep, so they can't just completely knock you out. So they said, when they're explaining the surgery to you, okay, what we're going to do is we're going to drill a hole in your skull, and we'll put these wires in, and the shaking will go away. P.S. You're awake while it happens.
Nice. So, and you said it didn't hurt much in the common sense when they were drilling in. Is that because when they're messing with the brain, rather, because there's no feeling up there?
You would think that there's tons of nerve endings, but there really aren't. You can feel a vibration as it comes in, things like that. The worst part is you can hear it.
Yeah.
But could you feel even the bone being cut through, or do they give you a local or something?
They give you one local as they're drilling through, and that's about it.
And it's a hand drill.
Yeah, that was interesting.
It's a little on the sadistic side when you can hear him, and he's huffing and puffing as he's drilling through.
I expected
waiting for wood chips to fall out.
It's like an old school dentist where he puts his foot against your chest and pulls the tooth out. So they put these diodes in, and that connects to your pacemaker type thing, and that just stops the tremors.
Yeah, and the doctors don't really know exactly what happens or how the thing works. They just know that those electrical impulses that it sends out kind of override the tremor signals, so the tremors go away when it's turned on.
Now, one thing that I thought was really compelling about your story is that oftentimes when people have a condition like this, a doctor will come to them and say, hey, we want to try this on you. But you actually heard about this and you sought out this.
It was done experimentally in Des Moines, and one of the first patients that did it there had a reporter in surgery with him, and so they had a story about it in the paper. And I looked at that and I thought, wow, that sounds great. This sounds like the answer for me. So I just started doing some investigating and found out what it would take to get it done for me.
Now, is it on all the time? Or do you turn it off when you go to sleep, or what?
You can turn it off at night. You would think that it would prolong the battery life considerably, but it really doesn't. It might make a difference of maybe 2 months or so.
How do you change the batteries?
That's an outpatient basis. You can go in, surgery in and out.
Like a Ziploc thing?
Yeah, pretty much.
Really?
They give you a local there and take it out, hook the new one up, wire it up, and turn it on, make sure everything works properly.
And how long does it last altogether?
A battery will usually run anywhere from 3 to 5 years.
Wow. So I was thinking, well, what about the scar tissue? Because they have to keep cutting different spots, and pretty soon they're coming in through your armpit.
I've only had one battery replaced so far.
Right.
So I don't know
in 20 years, get back to us.
If there was a Jeff Ryan farmer hero action figure, it would have to say batteries not included, and then we would have to go and put in some batteries.
Right.
Anyway.
Awesome. Well, we want to talk about the funny thing you did with your bill. We got to take a commercial break first. He really stuck it to him. It's the KROC Early Morning Show.
John Barleycorn is always taking great pride in their wine.
Keeping you informed and updated. Thanks for listening.
8:21. Good morning. It's the KROC Early Morning Show with James and Corey. High today, 45 with some showers and isolated thunderstorms. It's 43 at 8:21. Whenever you have any kind of surgery done, it can be very expensive. And you it was 2 surgeries to cover the left and the right side of your brain. Was that correct?
Altogether, I've had 5, actually.
5. Jeff Ryan in the studio with us talking about surgeries he's had to help him stop shaking he had in his hands that just, made it interfered with your life.
What was the malady called again?
Essential tremor.
Essential tremor. All right.
And you had an interaction with the anesthetists. Not all of them.
When we had the first surgery, we did a TV story about that afterwards, and so I got a lot of people who contacted me and wanted to learn more about the surgery as a result. So I said, when we get the second implant done for another procedure, let's just have the reporters come in and do it, because I found out about this procedure through a story.
Okay.
So they'll come in and cover the story. So we did that, and at the time, the insurance companies and hospitals were having a big argument over their insurance coverage, signing universal contract. And when the surgery took place, you start getting the bills a couple weeks later, and one comes from anesthesia, and it's $1,350, and you wait a couple weeks, and then the check will come in from the insurance company. A couple weeks later, a check came in. It came to me instead of the doctors, and it was only $1,100. So I called them and started asking questions, and they said, well, we didn't sign our contract, so we weren't preferred providers, so we want the full amount. We won't settle for $1,100.
Wow.
We argued back and forth for a while, and I said, I've had this procedure done twice before, and you collected an average of $924, and it's $1,300 and something now. I didn't really feel like I was 50% more asleep for this one than I was for the others. So as we went round and round, I ended up having to pay the full amount. So I thought I would send him a check for $925, and maybe we could negotiate up. We'd settle for $1,100. We'd both walk away good. But I had to pay the full $427. So I happen to remember a phrase that some guy on a radio show in Rochester used to use all the time when he was talking about stupid things people would do. And do you happen to remember what that phrase was?
I believe it was I like to whap you upside the head with a sock full of pennies.
Exactly. So I called these doctors and I asked if I could stop in and pay my bill. And yes, that was no problem. Can I pay it in cash? Yeah, that's great. So I called a friend who works at a bank and I said, explained the situation to him, and I said, I have this problem with these people. Can you help me? I want $427 worth of pennies to pay them.
Excellent.
And he said, not a problem. We'll get them ordered. So we got all the pennies together. We pulled a couple other friends in, and we unrolled them because we wanted loose change. $427 worth of pennies weighs about 265 pounds.
Wow.
A little backbreaking.
It was. I had to get a little two-wheel cart, basically, to haul all my pennies in.
Nice. And so what did they say when you brought the pennies in?
I went down there to their office, which was down a long hall, and parked my pennies out in the hall. And then I went in, laid my statement down on the desk, and I said, I'm here to pay this bill. Can I pay it in cash? Because I wanted to make sure that was okay with them. And they said, yeah, no problem. So I said, well, I'll be right back. I have it out here with me. And I wheeled in my pennies, and I started lobbing all these loose pennies up on the desk. We had them in a couple of big bags and a couple of boxes. And so she just looked at me and said, you're paying this in pennies? And I said, yeah, that's right. One of the other people that was in the office came over then and said, we had some of them in boxes that were labeled with $25 a piece. And she said, oh, well, this will be easy to count here, 25, 50, 75. And then I threw the first loose bag up on the table. He said, oh.
Nice.
And so just to have a little bit more fun with them, then we threw in 3 extra pennies to make sure that they'd count it.
Wow.
And they did.
They did. I got my statement back about a week later, and it showed a payment in cash of $427.03. And they scotch taped 3 pennies to the bottom of the statement.
They're honest to a fault because they knew that you did that.
Wow.
The doctor probably came out and said, you're going to count every one of these pennies. Don't just accept it as right because he probably put more in there than he needed to. Well, that's
so basically
excellent.
You got your touche in. Wow.
I did. It felt good. Other people told me afterwards, there's other things you could have done even worse. But I said, no, I wanted to play by the rules.
No, you're giving them money.
Get the point across to them. Yeah, I paid my bill.
Mm-hmm.
That's great. I think it's nice that we were able to say something on the air that turned into something worthwhile.
Now, that was that the second or third procedure that had happened?
It was the third one when that happened. And I was watching the videotape of the surgery, and I saw this picture where the anesthesiologist is sitting there kind of with his feet up on the chair during surgery. And I thought, this does not look like a guy to me that deserves a 50% raise.
Wow.
He's not doing bonus work here.
So just after paying one of your bills like that, other procedures, new bills, so was your name basically red flagged from that point on? Were they like, well, let's take this guy seriously?
When I had another surgery later on, then they did almost the same thing and had another big chunk of change, about $180 or so that I had to pay. So I thought I'd go in for an encore performance. And I called him up and I asked about a bill. And I just gave him my account number and I didn't give him my name.
Right.
So she pulls up my account and you can tell she's waiting for it to come up on the screen. Okay, here it is, Mr. Oh, here we go, Mr. Ryan. Jeff Ryan. Oh, we know who you are. Don't pay it. Don't pay it. Don't pay it. This was a mistake.
Wow.
That's great.
Sweet.
It means you've been flagged. It means if you're a difficult patient, you get flagged. If you're a smarty pants patient, that's great.
Hey, got you out $180.
Now, they're gonna next time you go, they'll have to give you a Cadillac. Oh, good. So we have a Cadillac for you to ride in upstairs. That's awesome.
That's it. You have a great story, Jeff. And you're actually from Cresco, right?
That's correct.
Cresco, Iowa.
What a great town.
Yes.
Jim, Sue, Carmen, say hi to him next time he walks by the store. And tell us about the name of your farming organization.
Two Guys Farming Incorporated.
And you're the second guy.
I'm guy number 2.
And why did you call it that? Or why'd you get into the farming?
Well, we just needed a corporate name, and my brother used to do income taxes for a lot of people, and he had some interesting corporate names on some of those. Mm-hmm. And so we thought of that one. We thought, it's pretty to the point. That's what we do.
And the slogan on the card is?
Feeding the world, because Mayo Clinic was already doing brain surgery.
That's great.
Love it.
That is great. Well, we appreciate you coming in today, and I think it's having seen video of it, I think it's astounding, and it must have been a real life-changing event for you.
Yeah, it's made a huge difference for me.
Is it beyond going to restaurants and your daily work? What about social life? Does it change your social existence at all?
It's a whole lot easier to go out and be seen because before you didn't realize how much time you were spending hiding the condition from other people. A lot of people that found out I had the operation didn't even know I had the condition to begin with.
Right.
Oh, wow.
You're very successful at hiding your problem.
Yes.
But okay, well, that's awesome. Thanks for coming in, Jeff. We appreciate it.
Thanks so much, Jeff.
Have a great day. It is 8:28. It's the KROC Early Morning Show with James and Corey. Oops.
To war.
Well, Ted, you should be very happy. You can see Erica doesn't have any neurological deficit. Our next patient is representing our neurological business. His name is Jeff Ryan, and he has received 2 Activa devices for essential tremor. These are the brain pacemakers, as we call them. By the way, Jeff is also an individual who has type 1 diabetes, and he has recently received the MiniMed Paradigm insulin pump. Jeff is going to be introduced by Cliff Owens, the Vice President and General Manager of our Global Movement Disorders business. Cliff?